Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
This presentation is going to discuss the anatomy of the mandibular premolars, or oftentimes called bicuspids. The objectives of today's presentation are again to discuss the location and position of these teeth, to discuss a little bit of their occlusion, the way they bite. We're going over the individual morphology and the terminology associated with them, and to give you some identifying characteristics of these teeth. Our mandibular premolars are located essentially below our maxillary premolars, except they are exactly at this stage one half of tooth, or exactly one half a tooth anterior to our maxillary premolars. And the reason being is because of the narrowness of our three anterior teeth has allowed these mandibular teeth to keep in contact to shift ahead one half tooth. But of course this in our posterior teeth starts to allow for our intercuspidation, or our ability of these teeth to occlude or bite together in proper relation here. Not only are they one half teeth anterior to our maxillary premolars, but we have a situation now where our teeth are a half a tooth lingual to our maxillary teeth. And they are essentially, the cusps are occluding into the central fossas or central sulcus area of our maxillary premolars. Well, if we go to some of the anatomy of our individual teeth, we can start with our mandibular first premolar. And first of all, we want to identify this tooth. In identifying it, we could indicate that we have one very large cusp and one very small cusp. We have to identify it in relation to our cuspids and in relation to our other premolars. So here we have one large cusp and one small cusp. We also have two pits, which would be on the occlusal surface. Sometimes these may look like a cuspid, but we have two very prominent pits, which make it a premolar rather than a cuspid. And having one very large cusp, one small cusp, would make it a mandibular first rather than a second mandibular, or rather than maxillaries. Now, how are we going to identify mesial from distal on this tooth? Well, if we look at the occlusal outline of this tooth, we can indicate that there is one line angle which is what I call flattened, right through here. And what we might do is just to make a sketch on this to emphasize it. If we're talking about our seconds, we generally have a very symmetrical, roundish type of an outline form occlusally. When we're talking about our mandibular first premolar, we've got exactly the same thing except for one angle, which instead of being round has a tendency to flatten. And that's probably one of the easiest ways to identify it. And this is the mesial lingual on this tooth. Let's look at the tooth again. Maybe we can identify it a little better on it now. It's this angle right in here, which is the flattened angle. It's called the mesial lingual angle. And we have a groove which comes out and crosses the height of the marginal ridge in this area, and it's right at the mesial lingual line angle. So where we've got this flattened area, we've got this mesial lingual groove which comes out and crosses. Now that will identify our mesial on this tooth very reliably. And actually, if we look to the mandible, we may be able to identify this area. Now, our tongue would normally lie in the area in here. We've got very narrow incisors from the labial to the lingual, and as we come to the posteriors, they become very wide from the buccal to the lingual. And our premolar tooth here is a transitional tooth. It is the transition between our narrow incisors and cuspids to our wider posterior teeth. And this mesial lingual angle is a narrow angle in comparison to our distal lingual angle, which has a tendency to widen out on these teeth. So you might think of it in relation to the construction of the arch. It falls into the arch development pattern rather well. Well, let's take our various positions on these teeth. Yeah, let's get it in anatomical position here. There we are. It looks like a mandibular tooth now. If we look at the buccal aspect of this tooth, we'll find that it really doesn't vary very much from a cuspid. It looks very similar to a cuspid in the buccal aspect. We've got our cusp, which is fairly well centrally located, although we could have just a little bit shorter of a mesial buccal cusp bridge and a little longer distal buccal cusp bridge, but this is very difficult to see, and if the slightest bit of wear on this tooth, and it throws the position of the cusp off rather easily. Of course, this is where the tooth is occluding here. If we look to our lingual view on this tooth, we'll find that we can see most of the occlusal by looking at the lingual, because our lingual cusp here is so small that we see a big percentage of our occlusal anatomy. We won't get into the occlusal anatomy per se at this time. We'll find that the height of contours on our buccal or our lingual view are in the occlusal third of the tooth. Our lingual is a little bit narrower than our buccal, and we can see our whole buccal cusp outlined from the lingual. If we look to our mesial view on this tooth, we start to get quite a few differences that start to occur on it. First of all, we've got some height of contours that are fairly significantly different. And if we were to, again, kind of lay a Bowley gauge over to help identify these height of contours, we would find that on the buccal, let's get her laid right on here, good. On the buccal, our height of contour is more or less at a junction between the cervical third and the middle third. It's not really real close to the cervical. On the lingual surface, the height of contour is in the middle portion of the tooth. But if you'll notice, it's actually very close to the lingual cusp tip. On the buccal, it is at the junction of the cervical and middle thirds. Secondly, we'll notice that really our, if we can see more of the root here, our buccal cusp on this is almost centrally located, and very frequently said to be centrally located right over the root trunk, which is, again, rather different than our maxillary premolars, and it'll be different than our mandibular second. We'll find that our lingual cusp is considerably out on the lingual surface. In fact, as if we were to drop down from the tip of the lingual cusp, it's almost even with the outline of the root. It's almost even with the edge of the outline of the root. We see that looking at this from the mesial, we can see our mesial lingual groove coming out. We can see that our mesial marginal ridge here drops from the height of a cusp towards the cervical as it comes down to the mesial buccal line angle, and then continues to drop until it gets all the way to our mesial lingual groove, which is the lowest point on our mesial marginal ridge. Now, this has not been that in any of the other premolars, but we reach our lowest point to our mesial marginal ridge right out at the mesial lingual line angle here. We also notice in our outline form that we've got a very prominent triangular ridges to our cusps. Very prominent. They almost connect up into a solid ridge, and we'll talk about this when we go to the occlusal. Quite frequently on these teeth we will have grooves on the mesial in the root, proximal root depression, proximal root groove, proximal root concavity, whatever you want to call it. It's quite common in the root on the mesial here. Notice that our cervical line is not too significant in its height. It's rather straight. In fact, as we look around the tooth, even out to the buccal and the lingual and the distal on it, our occlusal line is relatively straight around this tooth, and we haven't got the curvatures that we had in the anterior teeth. Getting way down here on the root. Should be up along in here, excuse me. Doesn't show real distinctly here. If we look to our distal outline, which we have here, we don't see a lot of differences on it. We haven't got our groove coming out across the ridge, and we haven't got very prominent root concavity or groove or sulcus on it. Other than that, we don't see a lot of difference on the distal aspect. Notice in looking at it in this aspect that from the height of contour on the buccal surface, this tooth has a tendency to flatten out considerably as it comes in the occlusal 2/3 up towards this very prominent buccal cusp. Now, function-wise, because of the prominence of this cusp, this tooth functions much as a cuspid, as a grasping or tearing type of tooth in function, rather than the grinding type of a function that the other posterior teeth have. If we look to our occlusal here now, we're going to come up with a lot of differences. Well, I guess we can leave her this way. You can see very prominently the groove that we've marked on that, but this is our mesial lingual groove, just so that you can keep your orientation on this tooth now. But we've got our very large, prominent buccal cusp almost directly in the center of the tooth. We've got a rather small lingual cusp. And sometimes this is in the center, sometimes it'll be a little bit mesial, sometimes it'll be a little bit distal. It's not real critical, usually very close to the center, but we can't say, as we did in our maxillary premolars, that it's mesially oriented or distally oriented. It's usually centrally or one way or the other a little bit. It's not that critical. And then we've got this ridge that connects up the two, and these are made up of the triangular ridge from the buccal cusp, our buccal triangular ridge, and our lingual triangular ridge. And they're so prominent that they cross this, what used to be the central groove, or they cross through the central sulcus in a solid ridge normally. And it has a specific term. It is called the transverse ridge. And this is the only tooth that technically has a transverse ridge, crossing directly from our buccal cusp to our lingual cusp. And it is one of the few new terms which we'll pick up on this particular tooth. If we look to our occlusal table on this, well, before we even look to the occlusal table, let's look at our buccal here a little bit. This tooth is characterized by having a rather prominent buccal ridge, as the maxillary first premolars did. It's more prominent than the mandibular second anyways, although it's not as prominent as what we had in our maxillary first premolar. And sometimes we'll get a little bit of concavities which will develop along in the areas between the three developmental growth centers on this. They're not usually real prominent, and you have to look for several teeth to find them, but occasionally you'll see these little depressions in the rather prominent buccal cusp ridge here. In looking at our occlusal form, let me go back to our diagrams here. This tooth is sometimes said to be triangular, or I should say diamond-shaped. Because of the prominence of this buccal cusp ridge, the textbook likes to call this a diamond-shaped tooth in this manner. But I like to refer to it as a round tooth with a flattened mesiolingual line angle. And it can be referred to, and you'll hear it referred to as either in its total outline form. If we look to the dimensions on this tooth, we'll find that it has exactly the same mesial distal width as does the mandibular second, as does the maxillary first and second. Generally, we're about 7 millimeters on an average from the mesial to the distal on this tooth. The big difference in this tooth being that the buccal lingual dimension is almost the same. This is what makes this tooth look so round, particularly in comparison to the maxillary premolars, which have got that oval or oblong shape to their outline form. We're generally about a ½ millimeter wider from the buccal to the lingual than we are mesially distally, but it's not enough so that frequently you can tell a great deal of difference on it. All right, let's go back to our occlusal table on this. Our occlusal table is made up of our ridges around the tooth. We've got our buccal cusp ridge, which is this whole buccal area, and this is frequently fairly straight. Remember in the maxillary first premolar we had a somewhat straight buccal cusp ridge. Here we have a straight one too, except it's not at tangent to the buccal lingual axis of the tooth or at an angle. It's fairly perpendicular to the buccal lingual axis of the tooth. And these again can be divided down into mesial buccal cusp ridge and distal buccal cusp ridge. We've got our mesial marginal ridge, which reaches its closest point to the cervical right out on the mesial lingual groove, mesial lingual line angle area. And our lingual cusp ridge, made up of the mesial lingual cusp ridge and the distal lingual cusp ridge. And we have a rather long, fairly prominent distal marginal ridge. Now this is, again, the only tooth in the mouth that has one specific characteristic, and that is that the distal marginal ridge is further from the cervical than what our mesial marginal ridge is. In all other teeth, posterior teeth in the mouth, this is the opposite. In the mandibular first premolar, the mesial marginal ridge becomes closer to the cervical. It's not an extremely reliable characteristic. It doesn't always occur, but generally it does, and it's usually close enough so you can't see a very large difference in it. It's not a strong identifying characteristic on it. But technically, the statistics indicate that the mesial marginal ridge usually is closer to the cervical, the only tooth that has that characteristic on it. Well, if we look to our inner occlusal aspect, well, before we do that, we might indicate that the occlusal table here is generally talked about being triangular. We have different shapes to our occlusal tables. This is a small occlusal table, really. One of the reasons why we don't get very much grinding activity out of it, it's more or less of a functional tooth as a cuspid here. It's said to be triangular in shape. We've got our base of the triangular across the buccal cusps and the tip of our apex to the lingual. If we look to the interior of our occlusal table here now, we notice two very sharp depressions or pits, which are separated by this transverse ridge. And on the mesial portion of it, we have our mesial fossa, or mesial triangular fossa, and a mesial pit. On the distal, we have our distal triangular fossa and our distal pit. Occasionally, this distal pit will be extended a little bit into a groove rather than just a very sharp pit, and occasionally they'll call this just a distal groove. It's usually parallel to the marginal ridge here. It's not usually broken down into a mesiobuccal occlusal groove or it'd be a distal here, a distal buccal occlusal groove or a distal lingual occlusal groove. It's sometimes just called a distal groove because it's a very short groove, but it's not a common term. It's generally just a pit and a fossa. Same exists on the mesial here. Occasionally this will have a called a mesial groove, but it's not very prominent, and just generally a mesial pit and a mesiolingual groove. The mesiolingual groove is the only real prominent characteristic groove on this tooth. Occasionally you might have an attempt of a groove to cross this transverse ridge. It's not usually very prominent, but if there was a little bit of a groove there, that would be a central groove. But again, it's one of the grooves that just aren't real characteristic on this tooth, although you may hear one referred to as such. Let's take a look at the way these teeth occlude. We're talking about our maxillary premolar as the central groove or central sulcus being right over the center of the root. And in our mandibular, we talk about this mandibular first premolar at least, our buccal cusp being fairly well centered over the root. Now in the mouth, these teeth occlude in this manner, and you can see why the distribution of the cusps and grooves as they are. The mandibular premolar is occluding with its main buccal cusp right into this central groove, which in turn places the stress on the maxillary tooth right over the center of the root. And also in our mandibular tooth, since our buccal cusp is in the center of the root, it also places the stress from the mandibular teeth right over the center of the root. Now, as we indicated earlier, there are some additional angles to these teeth that add to the complexity, but this is the basic orientation of most of our mandibular posterior teeth in relation to our maxillary teeth. These mandibular teeth, because of their prominence to this buccal cusp and because of the way they're occluding, frequently these mandibular crowns are said to be lingually tipped onto the root structure, the crown being lingually tipped. And actually, if we were to, it's a concept a little bit hard to see, but if we were to take a drawing of this, we might indicate that our crown, being our box, would have a tendency to be tipped on the crown in comparison to our maxillary tooth, which has a tendency to be directly underneath the root structure. And this is what they're meaning by this lingual tipping of this crown. This kind of prominent characteristic of most of our mandibular premolars, and molars too, I guess. Actually, when we look to this tooth, we can find a couple other characteristics that are, let's see, let's get her oriented here again. There we are. That are fairly prominent. One of them that's not mentioned in the textbook that I have used as an identifying characteristic for a long time, and that is, if we look at the buccal, or these pits, your mesial and distal pits, in comparison to our buccal cusp ridge, we find that the mesial pit is located much closer to the buccal cusp ridge, which is kind of expected because we got this flattened mesial lingual line angle. And our distal pit is not quite as close to our buccal cusp ridge. There seems to be a asymmetry to the closeness of these to our buccal cusp ridge, which usually is quite prominent in characteristics. And oftentimes these will be stained or decayed or filled, and there's rather sharp difference in those two orientations of those pits. The other thing that should be indicated here, of course, is that our distal fossa is usually considerably larger than our mesial fossa, again, basically because of this flattening of this mesial lingual line angle. But these teeth should be relatively easy teeth to identify. Let's take a look at our mandibular second premolars. And first off, we want to identify the tooth. And here we're going to be talking about three cusp teeth. At least most of the mandibular second premolars are three cusp, and that's the one we'll orient on, where we have one main buccal cusp and then two smaller lingually oriented cusps on the lingual, a mesiolingual and a distal lingual. But it is generally the only three cusp tooth, at least that has one root on it and of this size. Occasionally a maxillary third molar will have three cusps, but this is considered the only three cusp, one rooted tooth. It would be our mandibular second premolar. If we only had one lingual cusp, and occasionally we will, we'd have to look to other characteristics on this. One of the characteristics is, again, that this crown is lingually oriented. Its buccal cusp pulls over quite a ways onto our root structure. Not as far as our first premolar, but considerably more than our maxillary teeth. And again, our lingual cusps are way out on the lingual surface. Our central groove is not over the center of the tooth. So we just have this so-called tipping, lingual tipping of our crown in proportion to our root structure. And then, of course, our lingual cusps are of much greater size than what our lingual cusp is on our mandibular first premolar. So this will identify it pretty much. Now, if we wanted to identify mesial from distal on this tooth, which is the next thing that we need to identify, we'd look to the lingual surface. Again, in practically every instance, we can look to the lingual surface and decide mesial from distal. And this is basically by the size of our lingual cusp. Our mesial lingual cusp is the largest. If there's only one cusp on the tooth, it is located towards the mesial, as our maxillary premolars were. So this will identify our mesial from the distal on it. Actually, as in the first premolar and as in most of the rest of the premolars, we've got the same basic orientation as far as our point angles and line angles. We've got all the same terminology there, so we won't stop and go into that in detail. Basically speaking, occlusal outline-wise, we're talking about a rounded type of tooth or a symmetrical type of tooth. We haven't got a flattened angle on it. We haven't got an oblong type of a occlusal outline. The textbook actually calls it a squarish type of an occlusal anatomy. We're pointing out the symmetry of it. And again, on our width, we're talking about mesially distally, an average of 7 millimeters. And this will be the same for all the other three premolars. On our buccal lingual dimension, we're talking about just a little bit more than 7.5 to 8. So it could be just a little bit broader buccal lingually, but not much. It still gives it this roundish appearance here. If we go to our, let's get her in anatomical position again here, our buccal view on it, we'll find that our buccal outline form is not too significantly different from our first premolars or our cuspids. We do have a fairly significant tapering towards the cervical line on these. But one thing that does become prominent on it, and this is the cusp. The cusp angle is not real sharp. And we should point this out. This is kind of a characteristic between maxillary and mandibular cusps. Our mandibular cusps are frequently not too sharp. Our maxillary cusp, and I'll draw this upside down here, but in comparison, would have more of a tendency to be sharper in general. So mandibular cusps are said to be blunted on the buccal here quite significantly. In fact, as lingual ones too, in comparison to the sharper cusp which occur on our maxillary premolars and molar teeth. Otherwise, we've got fairly similar buccal outline to what our mandibular first premolars and cuspids are. Our, again, cervical line is not significant. It's fairly straight most of the way around the tooth. We are a little bit broader on the buccal portion of our root than we are on the lingual portion. We'll take a look at the lingual. Lingual gets a little bit narrower, and this is generally characteristic of most of our single-rooted teeth. It was characteristic in the first premolar also. We're a little broader in the buccal portion of the root than we are the lingual. It tapers as the arc is coming around. On our lingual, we're not seeing as much of our occlusal surface. We're seeing very little because of the size of our lingual cusps. And here we have two lingual cusps, and we've got a groove in between them. This is called our lingual groove, almost in the center of the tooth here. If we look to our mesial outline form, let me get her oriented here again. Again, we find that our height of contours are similar to our mandibular first premolar. Our height of contour on the buccal is not real close to the cervical, but it's kind of in between the junction of the cervical third and the occlusal third. On the lingual, it is located either within the occlusal third or at the junction between the middle and the occlusal thirds. Here. Did I say occlusal third? And I think I made a wrong statement here. The junction here is between the middle third and the cervical third is where our height of contour is. On our lingual surface, our junction is between the middle third and the occlusal third, so it's much closer to the occlusal surface on the lingual. We'll find that our buccal cusp is the most prominent cusp, but it's not centrally located over this tooth. Actually, if we were to try to section it down, we'd find that maybe it was a third of the way into the tooth. Our central groove, which we've got more of a groove here, we haven't got this strong transverse ridge in our outline form here. We've got a groove actually cutting through here now. This is not centrally located either. This may be, again, a third of the way to the lingual. Kind of divides our tooth into thirds here from our buccal cusp and our central groove, central sulcus area. Our lingual cusp are located rather prominently out on the lingual surface and almost in line with our lingual root outline again. We've got no specific grooves on the mesial as we did in our mandibular first premolars. We've got a usual bicuspid type of marginal ridge here. On the distal outline form, we find that our distal lingual cusp is usually the smallest cusp, and as a result, we frequently can see the more prominent mesiolingual cusp as we look from the distal. Like most of our premolars and molars, all of them except the first, our distal marginal ridge will come closer to the cervical. And again, the cervical line is not prominent in these posterior teeth. It's relatively straight pretty much all the way around the tooth. We've got the same basic proportions to our tooth here. Let's look to our occlusal here. This is where we pick up a fair amount of difference on our tooth. Let's see here how we have this oriented. This is, well, let's start with our buccal cusp. We don't usually have a real prominent buccal ridge on this tooth, although there may be somewhat of one. We don't normally have much of a depression, if any. It's generally said not to have any depressions where we've got our 3 developmental lobes on the buccal. So we're generally very small prominence to our buccal ridge and no depressions on the buccal surface. Our buccal cusp is not centrally located, as we indicated, and our buccal triangular ridge is very prominent, but it comes down into a central sulcus area, central groove area, and is different from our 2 triangular ridges on the lingual. We've got a mesial lingual cusp and a mesial lingual triangular ridge. A distal lingual cusp, the smallest of the 3, and a distal lingual triangular ridge. Now if we outline our occlusal table on here, we've got our buccal cusp ridge, a mesial marginal ridge on this tooth, usually fairly characteristic and prominent, our mesial buccal cusp ridge, which we can divide down into 2 areas if we want. We can call this our mesial incline of our mesial lingual cusp. I said should have been lingual here. We call this our mesial lingual cusp ridge and our mesial incline of the mesial lingual cusp. We've got 2 mesial inclines on our lingual cusps here, so we have to differentiate those. We've got a lingual cusp, pardon me, a distal lingual cusp, which would have the same marginal, well, cusp ridges on it, we'd have to call it. And these are crossed by our lingual groove. And we've got our distal marginal ridge. And this makes ourselves an occlusal table on this tooth. This is generally said to be rounded and much broader than what our occlusal table is on our mandibular first premolar, and this tooth function-wise is said to be more of a grinding or chewing type of tooth similar to our molars. Now on the interocclusal aspect of this, and let me see if I can wipe some of this pencil off here, don't get too confusing. This varies considerably. We're said to have this is said to be a Y-shaped tooth. If we look at our grooves, I guess would be the easiest thing first here. We end up with somewhat of a Y shape to our grooves. And around these grooves, we will have our pits. We're said to have a mesial pit around a mesial fossa, a central pit in this tooth now, and a distal pit, again around a distal fossa and possibly a central fossa. The grooves on these teeth become variable in terminology. If we're dealing with a Y-shaped tooth, our textbook calls our grooves a mesial groove, coming into the central fossa, and a distal groove coming into the central fossa, and then our lingual groove. So this would be the terms of our grooves coming in this particular tooth. Actually, when we look to some of our other types of premolars, we'll find that these premolars do vary, and although they're most commonly 3 cusps, we will have other types. This type of a premolar here is generally referred to as a H-shaped premolar, very similar to the basic anatomy in our maxillary premolars. And here we would have a central groove with a mesial fossa, mesial pit, and a distal fossa and distal pit. And then basically the terms of our grooves that we had before. Now, this is kind of a one-cusp tooth, one major cusp here. And sometimes this, if we're dealing with an H-shaped tooth, this cusp on the distal lingual line angle becomes very small. Sometimes it's so small that we don't know whether to really call it a cusp. And the text and terminology sometimes calls this a cusplet or a tubercle, which is a term that can be referred to as a very small cusp that's out on this distal lingual line angle area here. We have one other major type of anatomy on our mandibular seconds, and this is what's called a U-shaped tooth, in which we've got a central groove that is kind of in a U shape on it, and it doesn't have this Y branch coming out, this strong lingual groove. It leaves for a fairly prominent lingual cusp bridge around here, and sometimes one, sometimes it'll be 2 smaller lingual cusps on it, but the main grooves are just in U. So when we talk about our mandibular second premolars, we frequently will talk about a U-shaped, an H-shaped, and a Y-shaped. And interocclusal terminology will vary a little bit depending upon which shape we're talking about. But very frequently we'll be talking about a mesial pit and a distal pit. We're frequently talking about a central groove in these teeth, and oftentimes a lingual groove that may be coming out directly to the lingual on it. So there'll be a little bit of variation on it, but very definitely some of them have definite terms on it, such as this lingual groove on this Y shape. There's no question about the terminology in that particular tooth. Let's take a look at the pulpal morphology on these teeth. Before we do, let's look at the external morphology of the root a little closer here. Generally, we're involved with a single root on both our first and second premolars, and it's generally a very non-characteristic root in so much as we frequently don't have a lot of variations in it. The only variation that is of too much significance is on the mesial of our first premolar, we occasionally will have a groove. This is not commonly found in any of the other ones, but on the root we'll occasionally find a groove here. In looking at this, we'll find that the root is fairly broad from the buccal to the lingual. It's almost as broad as our crown is here. But from the buccal view here, we find that the crown tapers in considerably, and we get a narrower root from the mesial to the distal. This is similar to what all of our other mandibular anteriors have been. We've been narrow mesially distally and broader on the buccal lingual. And again, we pointed out that our root is mesially distally, a little bit broader towards the buccal and a little bit narrower towards the lingual. So if we have the basic outline form of our external root morphology, this will aid us significantly in looking internally into this tooth, because the internal morphology simply basically follows our external. If we look at a mesial distal section over here of our mandibular first premolar, we'll find that we have a very narrow, relatively straight, non-significant canal as far as a lot of variations are concerned. Our pulp chamber kind of flows right into our root canal, and they're approximate size in this view here, but it's just narrow mesially distally. If we look to a buccal lingual section here now, we find that our pulp chamber becomes quite wide, from the buccal to the lingual, and frequently we'll have two separate pulp horns, one prominent under the buccal cusp, sometimes a small pulp horn coming up under our lingual cusp. We're not showing any here at all. Frequently we'll have one canal in this tooth. This tooth shows a variation, and worthy of pointing out, I think. That is, occasionally, even though the root is single, this will divide into two canals. And sometimes this doesn't divide into these two canals until it gets down to the middle half of the root, or more frequently the apical third of the root, before it divides into two canals. So we have to be aware of the possibility. Even though we've got a single pulp chamber and the beginning of our root canal may be singly, we could divide into two pulp canals down towards the apex on it. If we look to our mandibular second premolars, find in our buccal lingual section here, we can see more prominently our two pulp horns, our buccal pulp horn and our lingual pulp horn. And here again we're rather wide, as our root is from the buccal to the lingual, and our pulp chamber is rather characteristically wide, and our root canal starts to taper down into a narrow canal here rather rapidly. On our mesial distal view again, we've just got a long, narrow view of our pulp cavity, including our pulp chamber and root canal, which are hard to distinguish in this particular view. Actually, if we were to look at a cross-section, and something you should get used to, or transverse section through the root, around the cervix of it, we'd find that our tooth here in diagram form is a little bit like our maxillary premolars we would expect. It's a little bit long and narrow. And our pulp cavity in here would be similarly kind of long and narrow, a little bit broader out towards the buccal, following just essentially the external morphology of our root.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.